First of all, let's just get your reaction to the CQC's report and findings.
We take everything that's in there and we're going to act on it, but we're really disappointed. We've been trying hard to improve things, but clearly we haven't improved them at the pace and as sustainably as we should have done. So we're going to have to redouble our efforts and go faster and harder, because we acknowledge that the safety of patients is at risk here. So we've got to make sure that we do everything to help them.
Is there a sort of a larger concern that you took over 6 months ago?
Yeah.
And when we sat down and spoke with you then, that actually in that time certain things have got even worse. I mean, just sort of looking down the list, unsafe acute wards that were seriously understaffed, and there were ligature risks there as well. When you look at that and you think, actually in the 6 month period that I've done, things haven't improved, they've got worse, what does that make you feel?
Well, it's disappointing, but I also think it does reflect to some extent. I'm not being defensive, but what I think we have done in looking at our own weaknesses is actually flushed more out and identified more of the problems ourselves. And those have been identified and spotted. So we recognise that. In the report it talks about 46% downgrading of emergency referrals. Well, it's now 6% because we knew that was wrong, and we put things in place to try and improve that. So in that sense, it is a snapshot in time. We have to learn from it. We are improving, but we need to improve faster.
The CQC said, with regard to the management, that management are too detached from the day-to-day running of the trust, that you just don't know what's going on effectively in some areas. Therefore, of course, you're not in a position to be able to act on those areas that you're not aware of.
It is a very big trust, and we've got a new team in place. I mean, I've only just completed recruiting to the team last week when our Director of Nursing started. So we have pretty much a brand new team, all people who came here knowing what needed to be done with the trust, and are very keen and eager to get on and do it. And part of what we need to do is to be out there working with our staff. We've got scheduled 100 events with our own staff over the next couple of months to kind of go and talk through with them what needs to change. There are a lot of things that are wrong with the organisation, but culturally, it's not been clinically led. It's not been something where doctors, nurses and therapists have been in control of how things can change. So we want to change that. We want to put them in control and go and talk to them about how that can be helped by the trust rather than hindered.
Do you accept that you were too detached?
I've always tried to, since I've got here, I've tried to get out and see what's going on and talk to people and listen and really hear about what's happening, not just about staff, but also from service users and carers as well. So I think, I think in a sense, it is a completely new team, and we're trying to be different.
Let's pick over again some of the specifics of the CQC report. One of the areas that they said was downgrading of urgent referrals and staff covering up waiting lists. I mean, that is really damning stuff.
Well, to me, that is probably my biggest concern.
Yeah.
That if there's a chance that people are not accessing our services because they're being put on a waiting list somewhere, and then harm comes to them, that's really bad. We recognise those kind of things are unacceptable. We can't have that kind of thing happening, because we've got to keep people safe, and safety is the primary concern for a very vulnerable client group.
Were you aware of the downgrading of referrals?
Not until we looked at it, no. Not until September we weren't. I mean, I knew that the referrals were looked at. I wasn't aware of the numbers, and it was only when we kind of became more aware of the numbers that we started thinking, oh, this is wrong. We need to do something.
Should you have been aware of the downgrading of referrals?
Well, it's hindsight's a wonderful thing.
Yeah.
As soon as we became aware, we thought we needed to do something, so we've acted on that. It is only in the last 3 months or so. It's certainly not in the last couple of weeks. We've been looking at this for a while. But yeah, I mean, we should know everything that's going on.
You were rated inadequate in the areas of safety, management and response as well. Now, in some cases, patients have been waiting for 5 years for help. I mean, well, how can that be?
Well, so it is unacceptable to have to wait for that sort of time for help. I think part of what we have to do in response to the fact that there is enormous pressure on mental health services across the country, we need to make sure that the most vulnerable are being made safe and are being looked at. We can't always deal with everybody who comes to us, because if we're going to concentrate on them, that means we may have to find alternative sources of service. And work more closely with our colleagues in primary care. So, we're going to have to look at the whole pathway of how people come into our organisation and what they get. Our job is to treat the severely mentally ill as quickly as possible and keep them safe.
Is the issue about identifying the clinically mentally ill that you talk about there, about people who sort of say, my son, my daughter cried for help, we went to the services, they were effectively pushed away, they weren't given the help that they needed. Is it about identifying? I mean, no one's going to sort of sit here and sort of say clearly you can be able to 100% of the time be able to work out exactly who is clinically ill the whole time. But does it need to be better though?
Well, it is a challenge. I mean, perhaps unlike a physical ailment, like if your knee doesn't work properly, you go to a knee specialist and they can x-ray it and they know what's happening. Mental health is a judgment, it's a conversation, it's understanding not just the mental health of the person, but their social context, their family, their employment, all of those things that determine what's wrong with somebody. And judgments have to be made. And they're not, you can't be 100% accurate. So it's always a risk assessment. And we need to make sure that we minimise the mistakes there and make sure that we're able to help people who really need help. And the clinicians are massively dedicated. And the one thing I would highlight from the report is that we are still good for caring. Yeah. It recognises that our staff care and they want to do a good job. Our job is to help them to do that well.
I've sat here before with other chief executives, and we've sat here obviously with yourself as well, and we've heard the same thing said. Luckily, we're going to learn lessons, we're going to put things into place. The lessons never seem to be fully learned. Is that fair?
It may have been in the past, and in the end, words are just words. So you're going to have to judge us on what we do over the next few weeks. If things don't improve, then something's got to happen differently. We want to make the changes, and we think we can make the changes that are needed to improve things. But we're going to have to do it over the next few weeks and months, otherwise something else will have to happen.
Can you recruit what you need over the next few weeks and months? Is it possible?
Well, recruitment is a problem. It's a national problem. There isn't a massive supply of people wanting to work in mental health services. So we have to be clever. We have to try where we can. We have to look for innovation. So earlier today, I was talking to one of our allied health professionals about the fact that there's opportunity to use therapists much more widely than we have done in the past. We can't recruit doctors and nurses. Maybe we need to find other people to contribute to the team and give us a broader range of options.
What we've seen as well is, again, speaking to various people around the region, is that as a result of the lack of staff, many people are being sent out of the area, some as far away as Huddersfield, etc. I mean, that can't be right, can it?
No, absolutely. I mean, sending people away out of county is just it's not good for them, and it's got to be focused around the patient and what they need. We do have a plan to get down to 0 out of area placements by 2021. I know it's some way off, but it is an ambition to try and reduce that. Part of that is not just about having more beds, it's also about having alternatives to beds. So we're looking at setting up new crisis hub services that will allow people in crisis to go there rather than need a hospital bed. So it is about different options other than just having more beds in county.
You talked about turning around the time, weeks and months. How long realistically before you can say we are now in a position where we are confident that this is the right service, the right mental health service?
I think we need to do things quickly,
yeah.
And we won't reach a point and then stop. So there's a kind of, we want to get good and then better. But certainly I would want us by the spring of next year to if we were reassessed by CQC to say you're no longer inadequate, you've moved to something better than that. But we need to do some serious things quickly. Yeah. And we need to be able to demonstrate that to the public as well, because public confidence is very thin and we need to build that back up again.
Do you still have the appetite for the job?
Absolutely, yes. And we've got a new team, so that gives you extra strength, I think. And actually, a report like this makes you more determined. We're not hiding behind it. We recognise the issues that it throws up for us, and we want to fix them.
Let's look again at for some people it's too little too late. For some people say things got to change now. You've had a chance, it's not going to work. I mean, just taking a look at some of these today. Clive Lewis, MP for Norwich South, saying you've had your chance, the trust needs to go into administration, effectively ending the management as it stands at the moment. Norman Lamb, MP for North Norfolk, calling for West Suffolk MP and Health Secretary Matt Hancock to get involved with a root and branch approach there as well. And also over the years, MP Dan Poulter described aspects of your trust as a scandal. Is it too late?
Well, I don't think so. It'll be for others to decide what the kind of organisational solutions are. I think CQC want to give us a bit of a chance to show what we can do, and we have to do something with that. If there is something that changes the organisation and can make it better, I'm more than happy to get involved in that. What we want to do is not focus on the organisation, but focus on the services. So we need to improve things on the ground. We need to make sure that local services improve. If the organisation needs to change in the longer term, that's fine, but actually that's our focus of attention, services.
If they said to you now, actually, we want to make a change now, you would accept that for the betterment, would you? Or I mean, there is a point, isn't there, where effectively this is not about you, and
No,
this is about the betterment for the patients.
I mean, anything that improves things, we want to get involved in. I mean, there's a danger that if you focus on organisations, you do things with organisations. We need to focus on services. So whatever happens around the organisation, our primary focus is how do we keep people safe? What can we do to change things so that people can access our services quickly? That's the question, and we need to answer that one.
There is a precedent for this as well, isn't there? There's a similar problem, for example, for Bedfordshire and Luton Mental Health Trust, and they then turned to East London Foundation, who were an exceptional one. So again, there is an example of where help can be made and improvements can take place.
Well, East London Foundation Trust, they're our buddy trust, so we work closely with them, and they've come and helped us identify some of the things that we could do differently and better. So we're really happy to learn from an outstanding organisation like that. We're going to introduce a quality improvement programme. We'll be training 100 people in January in the organisation who will then be going out into the services to do the quality improvement work. And that's being led by East London Foundation Trust because of their track record and their experience. So we're more than happy to work with people who've got something to give us.
And a final word then, from all those people watching this evening who say they feel let down by the Trust, those who've even lost family members and say the Trust simply isn't working, what would you say?
Well, I think every instance of that is a tragedy, and we're sorry that that's happened. We want to make things better. It will take a bit of time, but we need to move really quickly. And we take everything that's in this report and we want to learn from it so that we can improve things. We have to look forward, we'll learn from the past, but we need to make sure that we do make change happen. I know that can just be words, so you will have to prove that with what we do.
Thanks for your time.
Okay, thank you.
Do you melt in here?
God. That's all great. If we just stay where we are, we're just going to do a few others and cut away.
Yep,
so
okay.
just,
God, so